This is Average Joe PT, where we're here to reduce anxiety, improve function, and master your pain. Isn't that right, Skully?
Mastering your pain.
That's right. And today we're going to go over good old-fashioned hip replacements. We're going to go over the two main competing types of hip replacements that you can have in today's surgical arena. And we're also going to go over some home treatment techniques and expectations that you might incur when you have a hip replacement. Now, if you're new to this channel, Skully and I, we'd love to have you part of our channel. We'd love to have you ring the bell. We bring content once or twice a week. We do lives on Wednesdays as well as Sundays, Eastern Standard Time. And if you want to be part of our family and reduce your pain, we want you to sit back, hold on, here we go. Hey Skully, why don't you give us the lowdown on what we're going to be doing today? I know we got something going on here. Oh, that's right.
We're going to be going over hip
That's
replacements
right, you're
today.
right, hip replacements. I'm silly sometimes. Now, throughout this video, you might see blue here on my leg, and that's going to represent the hip replacement. Or you might see a blanket or something crazy like that. What do you think, Skully?
We did the best we could.
Yeah. I did the best we can, right? And there's going to be these two wacky guys. They're going to be competing with each other. They're going to be talking about their viewpoints when it comes to having their idea of the correct hip replacement. So, let's go ahead and watch these two wackos get started.
Well, this is Dr. So-and-so, and I would like to tell you that the first approach and the best approach and the only approach is the backside approach. It's the gold standard. We've been doing it forever. We have very good outcomes with our patients. Yes, there are some restrictions that you just unfortunately have to live with, but if you want to have less pain, you're going to have to deal with some restrictions. Now, some people on the other side of the aisle say that the other approach is the best approach, but there's always complications with these new techniques. And with these new techniques comes challenges. Unexpected issues come up. And so I think the best approach that we should stick with is the backside approach. It's trusted, it's true, and it's been going on for years. And I think it's a good thing to keep on doing.
This is Dr. Cool Cats, and I'm telling you that the front approach is the best approach that you can have. It's a lot less restriction when you go home. I don't care what Mr. Know-It-All so-and-so doctor tells you that he's been doing it for 100 years and this is the best way. There's no other way that's better than mine because I'm Dr. Know-It-All. But I'm Cool Cats, and I'm telling you, over the last 10, 15 years, if you get the front approach done for your hip, there's no restriction except for you can't go back. That's basically it. You might have some of these other doctors that might give you one more restriction, like out to the side, but for the most part, who does that? If you will have to tie your shoe, you bend forwards. If you want to cross your leg, if you have to go to the bathroom, you don't have to worry about that with the front approach. But Dr. Know-It-All, so-and-so, he thinks his approach is the best. There's so many restrictions with that, it's mind-blowing. Now, both approaches are valid approaches, whether you're on Dr. Cool Cat's side or whether you're on Dr. So-and-side, Know-It-All side. Ain't that right, Skully?
There's some crazy doctors here, man.
Yeah, those are two characters, aren't they nuts? But that's really what happens in the arena of hip replacements. You have one that's done the back side, what we call the posterior lateral approach. That's been done over 30 years. And then you have the newer one that's been done for probably 10 or 15 years, maybe a little bit more than that, but not much longer, which is the anterior approach or the front approach, where they do the replacement from the front and the back muscles or the back lateral side muscles don't get damaged at all. And so there's a lot less restrictions in the front. But it all depends on the person. So today we're going to go over some treatment techniques that you should realize that you're going to need to be able to do after you have a hip replacement, as well as what are some expectations after that hip replacement. So I want you to buckle up, hold on, here we go. Now, Skully and I, we want to show you guys how you're supposed to, when you get home, go up and down your steps so you can actually get inside your house safely after a hip replacement. Isn't that right, Skully?
You gotta know how to get in and out of your house.
That's right,
Gotta
yeah.
do the stairs.
Well, let's go and show you. So, what you're going to do, let's just say this is your left leg, the hip replacement. You're going to go up good leg, the strong leg, and then you're going to bring that surgical leg up. And when you come down, you're coming down with the surgical leg first, and then the right leg. So we always want to come up with the good, and you want to go down with the bad. We got some treatment techniques that we need to go over. Let's start with number one.
I don't want to get on the floor
Well, we
again.
gotta get on the floor. You're gonna have to just deal with it. Something else. Okay, number one, here we go. All right, let's go ahead and get these exercises started. We're gonna take magic towel roll that we use for everything else. We're gonna stick it right underneath the knee. You're gonna push straight down into that towel. Hold 1, 2, 3, 4, 5, and relax. You're gonna feel it tighten up right in that thigh, and that's what we want. Try about 15 or 20 of those. Next one you're gonna do is do the ankle pumps. About 20 or 30 of those, just to keep that blood flow going, reducing the risk of blood clots. The next one you're going to do is just try and slide it up a little bit. Slide it up, slide it down. Slide it up. You might need help with this left arm, and then back down, just to keep that hip moving. That's 3 of them. Now the last one you want to do is just be lying right down there and just try and tighten your butt up and then relax. Just tighten that butt up and then relax. Hold for about 3 to 5 seconds. You do about 20 each rep. And then obviously continue to ice it, continue to elevate it.
I'd like to know how many times I'm gonna be on the floor this show. This is ridiculous.
I know, I'm on the floor again. Calm down. You're almost on the floor too. He's something else. He's just ridiculous sometimes. All right, so now we're going to show you is make sure that you're elevating your leg above your heart so you don't get a lot of swelling down to that ankle after having a hip replacement. So let's go ahead and show you. And so what you want to do is make sure either, in this case, I'm on the floor. You're not going to be on the floor when you have a hip replacement. You're probably going to be in the bed. But you want to make sure that someone has got your back, or in this case, your leg. And you want to make sure, let's just say it's the left leg, that's our hip replacement side. You want to make sure that you're at least above the heart. If you're down flat like this, it's not really above the heart. So you want to make sure that you put some pillows or something underneath that leg so that the fluid is going from your foot and toes and your ankles all the way back through. And so you don't want gravity being your number one enemy and pulling the fluid down to your ankle and giving you another problem. So always have your leg above your heart when you want to elevate and get the swelling out. Reminder though, if you have congestive heart failure, make sure you don't do this because we don't want to tax your heart. People have varying expectation after having a total hip replacement in regards to being able to walk, having a lot less pain, and all of a sudden thinking that they're going to have more function than they had before surgery. Isn't that right, Skully?
People have some crazy expectations. What can we say?
That's right. And so you have to realize that there's going to be a lot of post-surgical pain that you're going to have to recover from that might be just as much as the hip osteoarthritis or fracture or whatever it made you get a hip replacement in the first place. But understanding that that type of pain will go away quite quickly in comparison to the pain that was never going to go away if you didn't have the hip replacement in the first place. Also understanding that there are major restrictions when it comes to the hip replacement that we went over today. And so be mindful of that these expectations, you have to dampen them for probably a good 6 to 8 weeks. So what you think you might have recovered in 3 weeks, it's probably going to take at least twice as much or at least 3 times as long as what you thought you might get in the first 2 or 3 weeks. Skully and I would love to have you pick this next one out here and look over that, and so that you guys can go ahead and get an understanding of how to reduce your pain after that hip replacement, or maybe if you're not going to have the hip replaced, reduce your pain with some treatment techniques. Then you can go ahead and do that right up here, and I go over all types of different ways to reduce your pain. But until next time, we will want you to look up and keep smiling. See you next time, folks.